concussion, a child is at a higher risk for another concussion at a lesser force. And new research is trying to replace any misconceptions.
There's really no such thing as a mild concussion when we're treating it, when we're diagnosing it. A brain injury is a brain injury.
Dr. Joel Brenner is the medical director of CHKD Sports Medicine. He says the CDC study shows how concussions can affect a child's brain after impact.
Psychosocial problems such as depression or anxiety, looking for issues with sleep problems so they can be addressed. Also looking for balance problems or eye tracking problems.
Brenner says concussions can actually last longer for kids with a history of depression, anxiety, learning disorders, or ADHD. Parents should be aware of that. And in the Norfolk school system, for example,
concussions is 30% of the injuries that we deal with at the high school level and middle school level here in Norfolk.
The CDC study recommends that doctors stay away from CAT scans and brain imaging.
A CAT scan has radiation, and so we don't want to radiate the brain if it's not necessary.
And new research says children should rest for about 2 days after concussion, but then resume non-sports activities.
But we should try to normalize life as much as possible soon after that.
Brenner wants to remind parents that these brain injuries are common across many different sports.
This is not a football problem. Concussions occur in all sports. It occurs in soccer and baseball and lacrosse, in cheerleading and gymnastics.
There are concussion protocol guidelines in place for all Virginia schools. These include baseline testing and tracking the concussion history throughout. In studio, Evan Watson for 13 News Now.